everyone, and welcome to this PARE EMEUNET joint webinar on the updated EULAR recommendations for involving patient research partners in rheumatology research. I'm Milena Bond. I'm a clinical rheumatologist based in South Tyrol, Italy, and also a PhD candidate at the Paracelsus Medical University of Salzburg in Austria. And I'm really delighted to co-chair this wonderful webinar with my friend from Young PARE, Tanita. So hi, Tanita, and welcome.
Hi, I'm Tanita Christina Wilhelmer. I'm originally from Austria, but I'm currently living in Switzerland, but I'm still active in the Austrian Rheumaliga. I have been chair of Young PARE for 3 years, but my term ended 2022. And now I'm part of the editorial board of PARE, and yeah, I am excited to be co-chairing this webinar here.
Thank you very much, Tanita. And it's also, of course, my pleasure to introduce today's speakers, both actively very engaged in promoting patient involvement in rheumatology research. We have today here Christelle Awad, who is the chair of EMEUNET's Visibility and Global Affairs Committee and a rheumatologist at St. George Hospital at the University Medical Center in Beirut, Lebanon. And we also have Simon Stones, who is the chair-elect of PARE Committee and former a Young PARE member. He's also a medical communications specialist joining us from Manchester, UK. Hi both and welcome to this webinar. And what about our wonderful discussants for the panel discussion, Tanita?
We have 2 people at our panel discussion. First is Muriel. She is a consultant rheumatologist at the University Hospital of Zurich, and she is the country liaison for Switzerland, for EMEUNET for Switzerland. And she was a member of the task force that developed the recommendations for patient involvement in rheumatology research, as well as part of the PRPs, sorry, study group, which aimed to identify barriers to PRP involvement in practice. And in Zurich, Muriel established a network of 60 PRPs, facilitating collaboration between PRPs and researchers in 14 projects already.
And we
Welcome.
also really. And we also have with us Dr. Diego Benavent, who is the chair-elect of EMEUNET. Welcome, Diego. And he's a consultant in rheumatologist at the University Hospital of Bellvitge in Barcelona. And together with Muriel, they were the EMEUNET representative in the EULAR task force for the updated recommendations for the involvement of patients as research partners. And so, Diego, as chair-elect of EMEUNET, you are the best person to give us an overview of EMEUNET activities, I think. So please go ahead, the screen is yours.
Thank you very much, Milena, for this kind of presentation. And thank you all for organizing this very, very nice activity, which, in my opinion, is at the core of what EMEUNET is about. In fact, I joined EMEUNET about 9 years ago after asking my mentor, how can I collaborate with peers from other countries? And without any doubt, she told me, you should join EMEUNET. And it's actually what I've been feeling these 9 years. So most of you know who EMEUNET is, who we are. Basically, the Emerging EULAR Network is a network that was created already 15 years ago by Daniel Aletaja, Maya Book, and Lorgosek, with a clear mission of promoting education about young rheumatologists and researchers in rheumatology, and to foster research and collaboration and integration into EULAR. And this small project at the beginning have been developed throughout 15 years until being an incredible network of 3,400 members nowadays. As you see, as you know, most of you know, it has allowed many people to collaborate, and it's established in this way that we have representatives in different countries, which are named country liaisons, and we have an structure in which there is a subcommittee with different subcommittee leaders, and there is the chairmanship that tries to coordinate all the subcommittee leaders and the subcommittee for all the activities. But it's basically all the EMEUNET community who is involved in many different activities. Just to give a brief overview of what we do, we have activities throughout the different CIFSAC committees. We will not go into detail now because there are many things to talk in this webinar, but basically we have Pierre leading the education subcommittee with different activities. Also, they do podcasts, they've done webinars. We have the peer mentoring with wonderful activities such as the mentor-mentee meetings at EULAR or the peer review mentoring, a nice project that has been conducted for several years now. The social media subcommittee, led by Siskean and Latika, has also been in charge of disseminating the work of EMEUNET throughout the different social networks, Facebook, Twitter, now LinkedIn as well. We have also Ertugrul leading the country liaison subcommittee, which, as you know, as I mentioned before, is a network spreading throughout Europe with representatives in each country, and which allows to collaborate in different ways. For example, in the upcoming project Rheumavision for the next EULAR Congress, they will be helping to select the different candidates in each country. Christelle is leading the Visibility and Global Affairs subcommittee, which organizes wonderful activities such as this webinar, and also many activities at EULAR, such as the EMEUNET booth or the EMEUNET event that, by the way, for those of you who are going to ACR, do not hesitate to join. There are the last few places, so don't hesitate to join us in ACR if you go. And then we have Anastasia leading the newsletter subcommittee, providing monthly newsletter with the latest activities done by EMEUNET. Here you see the latest meeting at EULAR of the EMEUNET subcommittee. I could not be there because I was just becoming a father, but I've seen many reviews of the meeting and also many comments of my colleagues and friends, and I'm sure it was wonderful as all the meetings of EMEUNET. Here, just an overview of the last map of the country liaisons of every country in Europe, and a small hint of the activities that were conducted in the last EULAR, in the EULAR Congress in Vienna. Sorry. Here we have the newsletter that is released every month with different topics. For example, we do one newsletter before the Congress, one newsletter after the Congresses, and also different newsletters on topics such as reviewing the literature or reviewing the EMEUNET subcommittee itself. Here, all the members of the EMEUNET community receive an email with this monthly newsletter. In this slide, sorry, that it went before, I wanted to highlight just some events of EULAR, particularly the event that EMEUNET conducted with PARE, and well, there were, according to the people that organized it, there were very nice experience in there, and hopefully we will keep improving this event for next editions. So yeah, this basically is. These are some activities that we conduct and EMEUNET, and this is how you can follow them in the social media, follow our podcast, and obviously follow some activities such as this webinar. I believe it's a wonderful way to grow with us and to grow all together in this network of becoming more a family and keeping us in every way better and better. Thank you for your attention, and now let's move on to the very interesting webinar. Thank you.
Thank you very much, Diego. Very nice activities indeed, and excellent presentation and overview. But now we are excited to hear about what Young PARES does and what are their activities. So please, Tanita.
As I was already introduced by the lovely Milena, I am presenting PARE, or in this case, Young PARE. And just in case someone doesn't know what PARE is, it's like EMEUNET is the doctor's part of EULAR. This is the patient part of EULAR. And we also have different working groups, and one of them is the Young PARE working group that was established. That was established for people between 18 and 35, just to get involved into the PARE activities and yeah, especially because people were seeing that the needs for young patients were not really met. That's why they decided to start this project a few years, like many years ago, actually already. And at the moment, we have 8 members in the working group from 7 different countries, and they are very motivated to be involved in the PARE activities. And the current chair is Mariana Cavallo from Portugal, and she's a very nice person. So if you want to get active with young PARE, get into contact with her. And the aim of the whole group is, as I already mentioned, to meet the needs of young people and also to improve the quality of life. And so one of the big steps that was planned and is already, how do you say, it's already in place, is that each PARE working group has one member that is between 18 and 35, so that the young people are already spread in all the activities. But the working group itself does also many things. For example, we have podcasts that I have the honor to be moderating at the moment, and we had different topics already. I have some examples. We had a podcast about growing up with an RMD, where we had some young patients that were already patients when they were a child or in their early youth. We had a podcast about studying abroad, because that's already like very difficult if you need medication and stuff. But also about traveling with a chronic illness, because, well, you have different needs than healthy people. And also about body image, because your body changes if you take medication. So that's just a few examples of the podcasts where they are very active and very motivated, but they also do webinars. For example, the latest one was how to build a youth group, because one of the aims is that every European country that is part of PARE also has a youth group, which is getting more and more, like we're reaching the goal more and more. Did I forget? Yeah, of course. We have workshops and presentation at the PARE conference, as well as at the EULAR conference. They are also involved in workshops and presentations. Yeah, and of course, we have a wider network, like not everyone in a working group, like PARE is more than just the working group. We have a wider network and we spread the word. If there's a nice thing happening somewhere, we try to connect people within the network. And how to get active with us? Well, if you're a patient and you are active in your own organization, you want to get active in the working group, you can apply to become a working group member. I sadly don't know when the next call for volunteers is, but it should be soon. Otherwise, you can just remember this link and go back to it. And if you're not a patient or like a doctor, for example, you can still help us out by following us on our different social media channels. And the handle is always EULAR Young PARE. And there you can see our activities and share and like and comment, which also helps. And as you saw on the slide before, we already have over 1,000 followers on Instagram, which is very nice. Okay, that's it so far, and yeah.
Fantastic, Tanita. Thank you very much. Let's make sure to follow your PARE and Young PARE social media. And now we are ready to move to the core part of the webinar with our two invited speakers. The first one is Crystal Awad. As mentioned, Crystal, you were the fellow of the EULAR task force for the updated recommendation for involving patient research partners in rheumatology. So you are the best person to give us the highlights and an overview of this recently published EULAR recommendation. So please, Crystal, go ahead.
Hi, hello everyone, and thank you, Milena, for the introduction. And I'm really happy to be here. And of course, on behalf of the task force, to be presenting this updated EULAR recommendation for the involvement of patient research partners in rheumatology research. So here are my disclosures. So first, let us introduce what is the term patient research partner. So in the medical literature, you'll find different terms to design patient research partners, such as patient expert, patient representative, lay member. What is a patient research partner? It's a person with a rheumatic and musculoskeletal disease who actually provides input to research through their experiential knowledge. So it's actually their lived condition with the disease. So they share their own perspective of the disease, and through their expertise, and this is usually gained over experiences in research projects through training, education. And the second definition of a patient research partner is also they are actively collaborating as equal partners with researchers. This is very important, and they are actually part of the two overarching principles of our updated recommendations. So why is it important to involve patients in research? Because now lately you've seen during the last 2 decades a real shift and transition from patient being passive subject to actually being really active collaborators in the clinical care with a shared decision making with the patient. You can see that. And also in research, they are actually now active, and by being a patient research partner, they can actively collaborate and give the patient perspective also in research projects. So this is a real shift that we've seen during the past few years, and it was also acknowledged by international organizations such as the WHO and the EMA, and even funders in some countries. They oblige the researcher and the principal investigator to include now patients in research in order to have funds for their projects. So the EULAR has always been the leader in patient involvement, and actually since 2011, they have already published recommendations on patient involvement. So it was more than 10 years ago. And these recommendations actually guided the other organizations such as the OMRAC, the Forum, and the GRAPPA to actually develop later on their own guidance. So these recommendations were actually based on mainly on expert opinion. This is why after having several years of more evidence, we've seen that that there is a need to update these recommendations. So this is why. So this is the task force. So it was convened by Professor Martin de Witt, and he's here with us. Hi, Martin. So and our methodologist was Professor Laure Gossec. We had EMEUNET members. So as you can see, Muriel and Diego, our panelists, were part of the steering group too. And again, these were the 25 members of the task force that helped in the updating these recommendations. Tanita also was part of this task force here. And as you can see, so a nice picture of all of us during the second meeting where we developed this recommendation. So now going back to the method. So how do we develop recommendations? So briefly, we actually follow the EULAR SOPs. First, we define the research questions. We propose them during the first meeting that was held in December 2022. Then there was a systematic literature review that was done and different scoping reviews of website of different research paper in order to have all the evidence in order to update the recommendation. And then we had the second meeting of the task force where we developed the recommendation, formulated the new definitions, all the sentences that you will see of the recommendations. We determined also the grade of recommendation, and there was a voting on the level of agreement in order to have, again, the final recommendations. So for the overarching principle, the first two were actually the definition that I presented on patient research partners. And the third overarching principle was actually about informer caregivers. So what are informer caregivers? They are actually persons. Usually they are not paid persons, they are not healthcare providers or nurses. They are actually usually parents of the person with a rheumatic disease. They live with this person or have a really close relationship with this person. However, the task force, sometimes informer caregivers, in some definition, we saw that they were included in the definition of patient research partners. However, the task force actually wanted to differentiate them. So they give a very important input to research, and it is usually complementary to the one of PRPs. For the exception for pediatric rheumatology, where kids, the parents of the children actually can serve as patient research partners. The fourth overarching principle is actually that patient research partner adds value to all the types of research, and we can really later on discuss why they add really relevance to this. Through the systematic literature review, we've seen that the involvement of patient research partner in research adds value not only for the patients themselves, but also for the research and for the researchers. For the patient, it let them better know about their disease, better know about the research, and again, sometimes practical skills. And even for the researchers, they let them better understand the need of the research and actually sometimes gain even new ideas when talking and involving patients in their research. And also for the research, it improves, of course, the quality of the research. The fifth overarching principle is about communication. So this is really a key, an essential part that we should stress on when to have an equal and successful collaboration between PRPs and researchers. And to avoid tokenism too, this is very important to have an open and transparent communication between all the stakeholders, all the research team, to have trust, respect, and willingness to learn from each other. So this is the key to have this. The first recommendation is actually so that PRP should be involved in all types of research. So this is an updated recommendation, and when we say all type of research, it includes basic and translational and clinical research. So because we saw the many benefits of involving patients, we should include them in all the type of research, even if it's basic, and we can discuss also this later on. So So researchers should involve also PRP from the inception of a research project and throughout all its stages. So as you can see, it's a level B of evidence. So it is based on many papers who actually reported the benefit to involve the patient since the beginning of your research project. So as you can see here, they should be involved since the conception of research questions, since the designing of the study, and then all the way through the dissemination of this research project. This is really very important because including them in the middle of the project sometimes will not be as good as involving them since the beginning. And then the third recommendation, this was an unchanged recommendation. A minimum of 2 PRP should be involved in each project. So, so the task force did not change this recommendation because 2 is a fair number. And the SLR showed that 2 PRP is beneficial in order to have a good involvement of patient research partners. And sometimes some project will need more than 2 PRPs. So it will depend on the type of the research and the workload in order to avoid also overburdening of PRPs if the project is really a big project. And fourth recommendation is about recruitment. So here, the task force decided to remove the competencies from the recruitment and actually stress on the importance of a consensual agreement of the roles and responsibilities of the patient research partner in the research study, and as well to define the roles of the researchers and the research team since the beginning, and it should aim for diversity and inclusivity. And when you see the SLR, so actually different studies selected PRP based on different competency or different types, or it depends actually on the research project. It could be because they're doing a project on rheumatoid arthritis, they need PRPs with RA, depending on the language spoken or the motivation to participate, or even their communication skills. So it really depends on what the researchers want. And when you ask how to recruit PRPs, there was in the SLR, we did not see any recruitment strategy that was more beneficial than another, but you can see that it is actually very wide. You can recruit patients from patient organizations, from social media, from community outreach, from even the research team, from connection or email invitation, or volunteering. So there's a lot of possibilities on how to recruit and where to recruit PRPs. The fifth recommendation is about, and this is very important, and it was a bit modified because now it's not the responsibility only of the principal investigator, but of all the research team to actually provide a supportive environment and facilitate the contribution of PRP to research. So, and usually in project, it's early researchers, early career researchers that actually take on this role to actually establish to actually address PRP personal issues and needs, to recognize their fatigue, maybe establish realistic deadlines, and write, for example, write or summarize a bit in lay language. So yes, this is very important, and it's the responsibility of all the research team. And the sixth recommendation is about the PRP coordinator. This is, we've seen in the SLR the emergence of a new role, and this is the role of the coordinator. And it is an essential role, and it's based on a high level of a grade of recommendations or high level of evidence. This coordinator actually should support the collaboration between PRPs and researcher. And as we've seen in the SLR, the coordinator can have different roles, sometimes in moderating the group discussions, sometimes in aligning the expectation between PRPs and researchers, organizing the logistics, organizing the training of the PRPs, even sometimes in the recruitment of PRPs. So, and they are able to assist at any stage. So the coordinator, who is it? It's a member of the research team. It could be the researchers, but it can also be one of the PRP, or a designated person from outside the research team could take on the role of a PRP coordinator. The seventh recommendation is actually about training. So not only PRP should have access to training, but also researchers can have access and should have access to training in order to have a good communication between PRPs as equal partner. And what is the content? So how do we train them? There's not actually a lot of decision over what to teach or educate researchers, but as you can see through the SLR, there's a lot of exercise that can be done, and essentially it's to let them avoid the medical jargon when talking and avoid complex medical terms in order to patients to be able to follow the discussion. And sometimes they can have even training for that, and also training on how to engage better PRP in research. The eighth recommendation is actually about training of PRP, and this is a level A of evidence behind this. So this is very essential for PRP to have access to training. And it can have different, there's different now education opportunities, such as, for example, the EULAR course for a patient to become a PRP. This is one example, but you can see here that you will have a lot of educational webinar training that will be available for patients in order to follow and be able to actively participate in the research. And then the ninth recommendation is about evaluation. So this is really very important because a researcher and PRP should be evaluated during the research project, and there should be an adjustment of their way of working when it is needed. So feedbacks are always very important in this collaboration. And finally, the 10th recommendation is about the recognition of PRPs. So the contribution of PRP must be appropriately recognized, and especially co-authorship if it's actually fits the Vancouver criteria or the ECGME criteria. We should include PRP as a co-author, or if it doesn't fit the criteria, they should be acknowledged in the paper. And then the financial compensation. So when a researcher presents his project to funders, they should think actually about a budget dedicated for PRPs. So these were the overall recommendation, and you can have a look also at our published paper that was published in June 2024. So thank you everyone, and I really want to thank especially all the members of the task force, and specifically 2 persons. So Martin DeWitt, who was the convener of the task force, Laure Gossec, who was the methodologist, who really both led this task force with excellence and worked hard to develop these recommendations. And I really want to thank also the EMEUNET members, Diego, Muriel, who participated as in the steering group, and all the patient research partners who were part also of this task force and were actively involved in all the process. So thank you all for your attention, and I'm of course available for any question.
Thank you very much, Christel. It was awesome to see again what the PRP working group has done. Sorry, my cat. And now we're going to Simon's talk. So he was one of the research partners involved in the task force that developed this updated EULAR recommendations. And you've been involved in research for many years, Simon. I know that. So it would be useful to hear your perspective on how the wider rheumatology community can help to implement the recommendations in their everyday practice. So
Thank you,
looking
Sanisa.
forward to your talk.
And I'm delighted to be here, and thank you again to the organisers for bringing this together. And I think Crystal did a superb job of setting out some of the things which I'm going to be covering in the next 10 to 15 minutes before we go into some discussion. And I really want to reflect on my experiences being involved in this particular task force, and also other EULAR task forces for developing recommendations and points to consider, as well as some simple suggestions for how we can make use of the opportunities we have and the challenges around making sure patient research partners are equal stakeholders involved in rheumatology research. As the team very kindly introduced me before, I am the chair-elect of the PARE committee, and I've been a EULAR PRP for around 10 years now. And certainly seen quite a lot of changes in that period of time, which I think we've already outlined, and the way that research is changing it is incredible. And I will touch on that in a moment. And I just want to say that obviously these views are of my own, and they don't necessarily reflect those of the PARE committee or EULAR. And we are really at an important point in time. And we've seen, as we said, over the last 20 years, a huge increase in the way in which research is being conducted. And I think I was very, very pleased to see last month that the World Medical Association, and if you work in research, you will be very familiar with the Declaration of Helsinki, which was first formulated in the 1940s. And it's around ethical principles for medical research involving human participants. And at the 75th General Assembly of the World Medical Association last month, patient engagement and involvement was actually incorporated into the Declaration of Helsinki. So there is no excuse anymore for us to think this is not a relevant part of conducting medical research. And I include the text that is from the General Principle 6 of the Declaration of Helsinki, which highlights the importance of meaningful engagement with potential and enrolled participants in research and their communities. And they really show that this should happen before, during, and following medical research. So there's no excuse anymore. It's in the Declaration of Helsinki. It is our responsibility as individuals working within the research community to make sure that patients are not just participants in research, which is important, but they are shaping and being involved in research, recognising their expertise and lived experience. What is it like to be a PRP on a EULAR task force? And I will say that this particular task force involved in developing the updated recommendations for PRPs was quite unique, because it is a 40-60 split of PRPs to rheumatologists, health professionals in rheumatology, and researchers. This is not, I think, typical of most task forces. And as one of the recommendations very clearly says, that there should be at least 2 patient research partners involved in any activity, which also applies to EULAR task forces. But I think what I particularly loved about this particular task force was that there were 10 PRPs with a huge variety of experience, networks, understanding of PRP involvement in research. And I think very, very uniquely that we had a convener who has PRP experience. And I think Martin I know you're on today's webinar, and I just think I want to thank you for your leadership, and I think you're a great role model actually for how other task forces should run, and how other conveners can actually adapt their ways of working to be more inclusive of patients. Because I think what Martin did very well, and the whole team who were brought together for this task force did, was enable that discussion, that debate to happen in a safe environment. You know, when you have patients in the room, and I've certainly been there many years ago when I haven't necessarily had the confidence to speak up, when you have, you know, distinguished researchers and clinicians around the table. And I remember thinking when I was certainly initially as a young PARE member, what is my role on this task force amongst all these experts? And it takes some confidence for you to realize that you have lots of expertise and that deserves to be heard. And that really can shine through when you have conveners, methodologists, and academic and clinical partners who acknowledge and reflect that expertise. And often, sometimes that can be a barrier for that open discussion. And so this is a call to anybody who's involved as an academic and clinical individual within a task force, is to sometimes take that step back and think, how can I be more inclusive of patient research partners? How can I bring them into that conversation and make it a really welcoming and safe space to different views? And that's not to say that we don't have debate. Debate is really healthy, and it's great to hear different perspectives and to ultimately arrive at the consensus which we did with the recommendations which we developed. And again, this was another example of how, again, adhering to our own recommendations which we developed, where we had PRPs involved throughout the whole process. So Martin and other colleagues actually highlighted the need for the recommendations to be updated. And then we were all involved through the systematic literature review, developing the recommendations, publishing them as well. And then also now looking at implementation, which is a really, really important focus for EULAR and actually for all recommendations. What is the point of having this excellent resource if we don't do anything with it to implement on a local, national and international level? And for me, there are 5 key components of how implementation can become a reality. It always starts with people. We need to have the right people around the table to make it happen. But we know people alone are not enough for these recommendations to be implemented. And we're often reliant on culture and how people view the importance of PRPs being involved in research, as well as organisations and resources and systems which can sometimes be a barrier for that successful implementation of PRPs throughout the whole research life cycle. So what can we do? And I want to say that PRPs are not a threat. I have seen this in lots of my experiences of PRP over the years, where PRP sometimes can be seen to be encroaching on researchers' land. And that is certainly not the case. You know, PRPs bring a different perspective, which is equally as important as the academic perspective, the clinical perspective, and all the other different roles which we have within different types of research. And I always say to people, you would never conduct a clinical trial without having a statistician involved, for example. I know nothing about statistics and don't really want to do, but that is their role and they bring a really valuable contribution to the table. So why would you conduct medical research without PRPs being involved when the output of your work is going to impact their lives? It's the same principle, different expertise, equal, sometimes maybe more value as part of the table. And so in the next few slides, I've just pulled out some of the recommendations which were included in the update published earlier this year. And just to give some potential solutions, which hopefully will just spark some ideas for us to think about as we go into our discussion for the rest of this evening and then moving forward as well. I probably spend a couple of hours actually describing some of the potential solutions. And I really want to re-emphasize that, you know, we want to change the world. We want to make PRP involvement the very, very best it can be. And that's always our ultimate, that's really my ultimate goal. But those small steps, those small incremental changes can really make a difference to setting that culture whereby PRPs are valued as equal partners. And I know there's lots of interest in basic and translational research, and there's been a historical narrative around, oh, patients don't understand basic research, therefore they shouldn't be involved. Actually, that is partly the researcher's responsibility to make sure you understand your research well enough to be able to bring patients in to explain, and that's why the training for researchers is really important, to be able to explain your research in terms which are understandable by patients. But there is a really, really important role with that research because, again, the ultimate aim is for that to translate into clinical benefit. And therefore, that is the very start of the research process, designing those kinds of questions which could have a real meaningful benefit later on. But are you asking the right questions? And very much with basic and translational research, making sure that patients are involved in saying, actually, this is important to us, this isn't important, can be really, really helpful to shape your trajectory with that kind of research. And I often find with those types of basic studies, that it's often more about the process rather than the content sometimes. So no matter the complexity of the science, PRPs have a role in that process. And it is about asking the right questions. Is this research going to potentially lead to a benefit for the patient community? And I think it's with all kinds of research, but particularly basic and translational, it's really important to have that plan in place about where PRPs are going to feed into the process, how you're going to manage that conversation, how you're going to make sure that they have enough understanding to be able to give you their expertise which can shape that research. And therefore, with those kinds of studies, you may need to build in more time in the earlier stages to have those upfront discussions to explain sometimes really complex science in a way which is accessible for those individuals, but also make sure that everyone feels comfortable with their role, and to know that they don't need to know this particular type of, RNA molecule which is being looked at, but actually, what does this mean for patients, and are we asking the right questions? And I always say this one, but that convenience is not always the best way. And this relates to recommendation number 4 around the recruitment of PRPs and that clear understanding of the roles and responsibilities and the aim for diversity and inclusivity. Now, there's lots of ways, and I think Crystal very nicely alluded to different ways in which you can engage your patients, and it will vary on the type of study that you're doing. Something that's been done by a master's student will be very, very different to a funded phase 3 clinical study, for example. So that needs to be taken into mind, and the principles applied to a particular type of research in question. But it's always really, really good to engage with patient organisations and associations as well. And they bring a different perspective. So aside from individual PRPs, they have that umbrella perspective of the landscape, what's currently the hot topics for the patient community, and they are really, really valuable resources to tap into and expertise to value, as well as individual PRPs. So they're always a great network and a great facilitator to those individual PRPs. And you can make use of networks which are already in existence. And so within the EULAR PARE community, we have our PRP network of individuals with extensive experience have been involved in research. So that's a great network which you can contact, and we can try to connect you with individual PRPs who may be able to help your research. And then there are lots of other groups. So different universities and hospitals have PPI, patient and public involvement groups and networks. And there are private providers, and some examples include Health Union and Savvy Cooperative, who actually bring together patient research partners and can help to connect you with those individuals. And I think I have a personal call to our researchers and academics on the call to try and reach people in their own environments. And this comes back to the header. Sometimes it's really, really, really easy, and I think this is still good, to utilize existing PRP contacts that you may have. You may have that relationship and it may be easier to bring them involved. But convenience is not always the best way. And I certainly, recognize that sometimes it's time for somebody else to have a role. And so we all have a responsibility to try to make sure that we widen our network of the PRP network. to make sure that we're bringing in fresh perspectives, that we are training and supporting people to become competent, to feel able to contribute. And I think that links very nicely to diversity. You know, we need to reach people where they are, which isn't always the easiest, especially when we're all so very busy. But it's a really important point to remember as we're trying to widen our network, to think, what can we do to get more people with lived experience involved in our research? And we mentioned that researchers should have access to training, but PRPs should be able to have access to training. And there is training available, but are you aware of it? So this is a plug for our upcoming third EULAR online course for patient research partners. The link is on screen, and the registration deadline is the end of this month on the 30th of November. And the EULAR online course, if you're not familiar with it, check out the link, have a look. It's a really, really rigorous, evidence-based and consensus-driven course, which covers a 2-year period, which really helps to train PRPs in every aspect of research. I think it's a great resource that we have. We're very proud of it, and we are also very, very happy that the EULAR board and council had agreed to waive the fee for the course to patient research partners on an understanding that they commit to being involved with the EULAR PRP network. So that is now in place. It's a really simple application, and so I recommend that PRPs on the call who are interested and maybe want to get more involved to check out that link, and for our academic and clinical colleagues to also share that with their contacts. And then it's also important to signpost to other providers. And I've just listed a couple on screen. So UPASI is probably a very familiar example. There is also the EUCAPA, which particularly focuses on regulatory aspects of research. We've got PFMD, the Patient Focused Medicine Development, and then the Canadian Institute for Health Research also has a patient engagement training course. So there's lots out there, but sometimes it can be very difficult to know where the training is and necessarily what is the best training. This particular recommendation, I think, is really important. Evaluation often is the dry subject, which we sometimes overlook, particularly when we're thinking about the feedback process, because it feels like it's an additional task, but it's a really, really important task. And it's that open and mutual feedback, which is really, really important to building trust and building those lasting relationships with PRPs and academic and clinical colleagues. And so there are some really, really simple things that we can all do. So the regular contact, I think, is really, really important to make sure that PRPs know who they can reach out to for support. That may be the researchers, it may be a PRP coordinator, it may be fellow PRPs and maybe more experienced, and can provide that mentorship sort of role for newer and less experienced PRPs. And you really need to have mechanisms of capturing feedback, and that could be a quick Teams call, taking some notes. It could be a short survey. There's lots of ways that feedback can be captured. And I'm going to jump to the fourth point here, but for me, it's really, really important that that feedback isn't just taken and then nothing's done with it, because that is the worst. We all know, we've all done the surveys and nothing happens with the feedback that we give. We want the feedback to be acknowledged. We want people to say, we've seen what you've said, we hear what you say, and we're going to try and do something about it. And you may not be able to do the changes that you want or the changes that are requested, but having that dialogue to say, we want to do this, this is maybe not practical, but how is this as a compromise, is really, really important to building that trust and demonstrating that change and that commitment to change. And I would say that that openness to feedback is really, really important. And it works both ways for academics and clinicians to be open to feedback from PRPs, but also for PRPs to actually take that feedback as well, to learn, to improve, to reflect. These are all really, really important aspects which we must consider. And then the 10th recommendation around the contribution of PRPs being appropriately recognised is something which is very, very close to my heart. And it's just this is to re-emphasise that PRPs have the same rights to co-authorship as academic and clinical researchers, as long as they meet the ICMJE, which is the International Council for Medical Journal Editors criteria for authorship. And so this applies to any individual. And I would say, I often see arguments from the more skeptical researchers who say, oh, patients can't be authors. actually I've seen, especially in the work that I do as a medical writer, that sometimes some academic and clinical colleagues on paper don't meet the criteria. So it's having this in mind from the very start, knowing that you're probably going to be publishing your research and making sure that everybody involved in your team, including PRPs, meet these 4 criteria. So it's a substantial contributions to the concept of the design of the work, or gathering the data, analysing the data, or interpreting that data and what that means, as well as the remaining 3 items there. So drafting the work and reviewing it, approving the final version to be published, and then agreeing to be accountable for all aspects of the work. And that's not to mean that PRPs should know all the intricate details of the statistical analysis, for example, but it's to know that, okay, that is certain individual's responsibility. And if I get a question on that, I can direct that individual to that element of the research. And I think the second point there related to financial compensation is also really, really important, and it's picking up quite a lot of momentum in recent years. And so this is just an important point to recognise that, you know, many PRPs are donating their time, their energy, as well as managing their own condition, their family life, often work as well, or education. And therefore, we should be considering about the financial burden of actually being involved in these kinds of activities. People often take annual leave to attend meetings, try to fit it in around their existing work, and often this is not their primary job. There's a very, very small percentage of PRPs are actually doing this as a professional role. So we really must consider this, and I think very strongly for when we're costing research and we're applying for grants, to make sure that we cost for PRPs to be involved and recognised for their time. This is about you know, it's the equality equity debate, making sure that actually the equity of being involved does not put PRPs at a disadvantage of their contributions. So there are some resources which are available. In the US, there is the National Health Council, their market value calculator. The Patient Information Forum in the UK very recently published their fair market value for charities involved in partnership work. And then the National Institute for Health and Care Research also has some payment guidance for researchers and professionals within the research space. So I really recommend that you look at that and think about that, especially when you are costing your research. And just finally, to highlight some resources from EULAR which are available, we have a really excellent guide and reference cards, which explores patient involvement in research, and they're freely available on the link which is shown on screen. And we also have a guide for starting a PRP group on a national level, which just gives some real practical tips for setting up that group on a national level. And I think with that, I will end, and thank you for listening, and look forward to our discussions now.
Thank you very much, Simon, and also Crystal, for the wonderful talks. Very interesting. We are now open for discussion. I think we can steal a couple of minutes from your evenings, and to the audience, you are allowed to ask questions either by speaking up or by writing a question in the chat. But in the meanwhile, maybe I can start with one question to all the speakers and also to our panelists. So to sum up, what do you think are the most significant barriers to PRP involvement, and which solution would you take, would you consider to improve these things? And I would like to hear about the physician perspective and also the patient perspective, if possible.
So yes, thank you, Milena. Actually, the barriers through the literature review, we've seen that it's actually on different levels. So it can be related to personal factors such as emotional burden, such as the fatigue from the PRP side. Sometimes a lack of trust between PRPs and researchers. So this is on a personal aspect. And sometimes they can also have some problems in the communications. They can feel that they are unheard maybe. When the researcher uses a lot of medical jargon, sometimes they can even feel that they are not really connected to the discussions. Mainly, there's a lot of barriers that we have identified through the literature review. And through these recommendations, we actually tried to find some solutions to this, and mainly the open and transparent communication is important in the overarching principle, in also the recommendation. When we talked about researchers who actually had to give a supportive environment for PRP. And the training also is really essential as a solution to overcome these barriers. So yes, Muriel, I think
Yes.
also.
Thank you. For me, there are two, I would say, yes, two main barriers. On one side, I'm not sure that all physicians and researchers see the benefits of including PRP in their research, in particular also in translational research, where it could be more difficult to include patient research partners. So as you said, it's important, I think, to train the researcher and to show them that PRP bring something to the research, because sometimes they want to include PRP, but to obtain fundings, because now it's warranted that PRP are included in research project, but then at the end we are in that's a type form of tokenisms, because they include them, but not on a good way. And also, yes, a second barrier that I see, but it's not maybe for PRP involvement, it's for diversity of PRP involvement, is that maybe the difficulties to plan the meeting outside of, or the logistic barriers to plan the meeting outside of working hours to compensate PRP for their work and so on.
Thank you very much, Muriel. And what about the perspective of Simon and Tanita? What do you think? What's your perspective on this topic?
I mean, I think I outlined something like the, you've got the personal, interpersonal challenges and barriers, which can be, individual culture, individual not realizing the value, I think, as Muriel said. But then you also have the organizational issues and barriers which are sometimes in place. So some organizations say, no, we don't pay patients. I know Sadia's put a quote in the chat about actually, assuming, oh, we're not going to pay those individuals, we're classing them as volunteers, and making those decisions without conversation. I think that can be really, really damaging. And so we've almost got to convince people. I think we need to start with people, and I think having the recommendations, that is a resource that you can say, look, EULAR have published these recommendations. You should be doing this, and use that as a facilitator to drive change within organizations. You can do so much from the ground up, but also you need leadership involved to be able to open up funds to enable individuals to make those changes. And I think we can really use these recommendations to try and leverage that change at the leadership level, which really does have an impact on how and how good patients are involved in research.
Sure. There is for sure a lot to do still, but these recommendations really helps in making things better for the future, I think. And I still have a question for our panelists, if we still have a couple of minutes. What do you think that is the really added value of PRP in research? Because there are many physicians and researchers that are not so convinced that this really brings something into their clinical studies. How would you answer this?
For me, I think it brings something, but the problem is that we cannot measure it. So we need to do qualitative studies, but it's a way of assessing the impact. But quantitative value is very difficult to assess it. And so what I can say, what it brings, I think research can be more relevant, but I think this in particular for translational research where researchers are not in contact with patients because they don't see a patient, or also it can motivate the researcher because they see the impact on the disease, the impact of the research on the patient, and yes, it would be, I think, the main added value of PRP in research and also for dissemination. But what is very difficult, I think, is that we don't measure it very easily. It's very difficult to measure the impact of PRP involvement in a research project because we don't know. We cannot do a randomized controlled trial with the same project with PRP and without PRP.
For sure. Thank you very much.
And I wanted finally to add also some advices because sometimes there are very early career researchers with us. So don't hesitate to include PRPs and patients into your research. Just make sure that your patient is actually motivated to be part of the research, that the patient has time to be involved in your research, and also involve them since the early phases of your research. So when you have the concept of a research project, try to involve them because you will have new ideas, maybe shape better your research question, and always remember another advice, not to communicate in lay language. So this is really important, not to use complex medical term when talking to them, because later on they will not be able to really focus on the discussion. They will lose track during the discussion. So this is really very important. And eventually, when you integrate them in your research project, always remember to ask for their feedbacks and evaluate their contribution, and maybe try to always try to do something about it, like Simon has highlighted in his presentation. So these are a bit some advices for that we can give to researchers.
There are questions in the chat. I think we can maybe discuss what is written in the chat. So first, about PRP task force, it's already finished, so it's already published, but then you can be involved in new initiative for PRP involvement for Zineb Amor. And there was a question for a patient who is a researcher and also diagnosed with arthritis from Kosovo, and he asked if it would be possible for him to contribute in PARE research groups. So Simon, maybe you can answer.
Yeah, I've just said if Tim can drop me an email, then we can have a chat. Obviously, there's certain rules and regulations about PARE member organisations, but I think more about patient involvement in research, and there's room for everybody to be involved in a capacity at European level. So yeah, drop me an email and I'll be able to hopefully connect you with the right people.
Yes,
Very efficient.
Yes, for all PRP or patients who would like to be involved, maybe in PARE activities, would be nice to contact Simon or the group to have more information about it. And there was also a topic about remuneration of PRP, and this, I think it's a very important topic. We face with the same problems in Switzerland, that we don't have any funding, or sometimes the PRP help us at the beginning of the project during the pre-submission phase, and then the project is not funded, and then the PRP are not compensated for their work. And for us, it's a big problem.
Yeah.
Do you have?
And I think I always have something to say on this, and you know, there are challenges around having the funding available to recognise people financially, but it's just a prompt for people to think about that. Would you work for free? And that is, you know, I think PRPs do so much voluntarily, as we all do, but academics and clinicians are paid for their role, whereas PRPs are not. And I think that's just a really important point to recognise that, you know, when they're bringing so much to the table, when they are donating their time and their energy, that it's only right and morally right to make sure, or attempt to make sure, that they are recognised financially and supported to be there, so that they are not at a loss, because that also feeds into making sure that we are reaching a wide group of diverse individuals, rather than people who can afford to be able to be at the table, whether that's financially or because of time and circumstances. So it's just an important reflection to keep it in our minds and to keep pushing for that equity, so people are there and are valued for their expertise, which is, as we said tonight, I think so important. And that landscape is changing, where we have collaboration, collaborative research as the only way forward.
Yeah, thank you very much, Simon, for answering this question, or having this. Yeah, like, I agree with you. And that's what I wanted to say. And thank you all participants for your lovely presentations. It was very, like, for me at least, it was easy to follow and to understand everything, and to be reminded why it is important to have PRPs in the project and how to involve them. And thank you. I think it's a very important topic, and I'm very happy that this webinar worked out with a collaboration between EMEUNET and PARE. And I wish everyone a good evening and a good night. And thank you all for joining and contributing to the discussion and listening to the presentation.
Thank you very
Good
much.
evening.
Thank you, everyone.
Thank you very much.
Goodbye.
Thank you.
Bye.
Bye.
Bye.